Right, good afternoon everybody. Today I'm joined by the Director of Public Health, Dr Caroline McElnay, who will provide today's cases update. After that I'm going to talk about masks on public transport. From next Monday, the 31st of August, the masks will become compulsory on public transport. I'll set out the details of that. I'm also going to provide a few comments on the just released report from the Independent Contact Tracing Assurance Committee and the response on that from the Ministry of Health. But first, let's get today's update.
Thank you, Minister. Tēnā koutou katoa. There are 7 new confirmed cases of COVID-19 to report in New Zealand today. One is an imported case, a woman in her 20s who arrived in New Zealand on August 22nd from Turkey via London and Hong Kong. She has been staying in a MIQ at the Sedima in Christchurch, tested positive for COVID-19 around day 3 of her time in managed isolation. The other 6 cases are in the community and they have all been linked to the Auckland cluster. 5 cases are household contacts of previously reported cases, and 1 is linked via their workplace. One of the new cases is a student at Mount Albert Grammar School, and Auckland Regional Public Health are currently working with the school, community and the Ministry of Education. The student has not been at school since the 12th of August. By this morning, our contact tracing team had identified 2,455 close contacts of cases, of which 2,404 have been contacted and are self-isolating, and we're in the process of contacting the rest. There are 159 people linked to the community cluster at the currently at the Auckland quarantine facility. This includes 85 people who have tested positive for COVID-19 and their household contacts. Just an update on those in hospital. Today we have 10 people in hospital with COVID-19. 2 people are in Auckland City Hospital, 4 people are in Middlemore, 3 people are at North Shore Hospital, and 1 person is in Waikato Hospital. 8 of those people are on a ward, and 1 person is in Middlemore is in ICU, as is 1 person in North Shore. 15 people are now considered to have recovered from COVID-19, which brings the number of active cases in New Zealand to 126, of which 11 are imported cases. Our total number of confirmed cases of COVID-19 is now 1,351, which is the number we report to WHO. Yesterday, our laboratories processed 9,257 tests for COVID-19, which brings the total number of tests completed to date to 719,320. And just finally, an update on the Mount Roskill Evangelical Fellowship Church cluster that we talked about yesterday. There are now 8 people associated with the church who have tested positive for COVID-19. All 8 cases have epidemiological links to each other, and they attended common events. 3 of those cases have been genomically linked to the Auckland community cluster. We are still investigating the epidemiological link to the main cluster. We'd just like to reiterate what was announced yesterday, that anyone who attended the following events should get tested as soon as possible. So services held at the church in Stoddard Road on the 8th, 9th or 11th of August, and a wedding that was held at the church on Friday the 7th of August. Anyone who attended these events and who is currently unwell or has experienced any signs of COVID-19 in the past 2 weeks should contact Healthline 0800 358 5453 and let them know that you attended one of these events, and they'll provide further advice. Thank you.
Thank you, Dr McElnay. The world keeps learning about this pandemic, and as we continue to learn, we continue to adapt our own practice in New Zealand based on the latest advice and evidence. On Monday, the Prime Minister announced that face coverings will become mandatory on public transport throughout the country when we are at COVID alert level 2 and above. That requirement will come into force on Monday the 31st of August when Auckland moves down from Alert Level 3 to join the rest of the country. Under Section 11 of the Covid-19 Public Health Response Act, I'll be signing a new order this afternoon that sets out how this is going to work in practice. I want to emphasise from the outset that face coverings are an added layer of protection in close environments. Maintaining physical distancing is still the best mechanism. We also know that some people won't be able to wear masks, and I'll talk about that a little bit more in a moment. So from Monday, face coverings should be worn on public transport and aircraft. That includes trains, buses and ferries. They do not need to be worn on school buses, on charter and group tours, on inter-island ferries or on private flights, or by private contractors of air services such as top dressers. These groups are already likely to be within each other's bubbles as part of a registered group or have space to physically distance, for example, on the inter-island ferries. In addition, face coverings do not need to be worn by passengers of small passenger vehicles, such as taxis or Uber, but the drivers will be required to wear masks. People under 12 years of age will be exempt in line with World Health Organization guidance. People with a disability or physical or mental condition that makes covering their face unsuitable will also not have to wear a mask. There will be other times when it's not required, for example in an emergency or where it's unsafe, if people need to prove their identity or if they're communicating with someone who is deaf or required by law. We do not have a mask wearing culture here in New Zealand. This is going to take us all some time to get used to, and so we do ask for patience and cooperation as we all get used to taking this additional protective step. What we're asking is for people to wear a face covering just as you would buckle up when you get into a car. Whilst a breach of this requirement without reasonable excuse could be subject to an infringement of up to $300 or a fine imposed by a court of up to $1,000. In the early stages of this, we do ask people to be kind and cooperative with one another while we all get used to these new requirements. Guidance will be going out to all transport operators on the requirements under Alert Level 2, including those around physical distancing, cleaning, QR codes and of course face coverings. We do ask that people respect drivers and transport operators. They're not obliged to refuse people entry, given that people will have legitimate reasons for not wearing a mask, and I've just gone through those. But drivers will be encouraged, where possible, and where they are comfortable, to ask passengers to wear a mask. Now is a good time for all New Zealanders to get themselves a mask or a supply of masks. We are releasing 3 million further masks from the national store for national distribution over coming days as a one-off boost to the immediate supply that's available. This will be distributed amongst iwi, social services groups and community food banks and centres in regions where there is public transport. You can also make your own, and there's guidance on the internet on how to do so. I would encourage people in particular to have a stock of reusable masks so that you can wash them between uses. Face coverings can be anything that covers your mouth and nose. That can include scarves and adapted t-shirts. Supplies of disposable masks are continuing to be distributed throughout the country. Moving on to the Roach report that's being released today. We are releasing the final report of the Contact Tracing Assurance Committee, the CTAC report, and the Ministry of Health's response to that. The committee was tasked with reviewing progress against the recommendations of Aisha Verrill's earlier report. The report concludes that New Zealand is now in an increasingly strong position and that we do have a much improved contact tracing regime. There are work-ons, including scenario planning and system stress testing recommended in the report. The Ministry was in the final stages of planning for this, but of course we then had that overtaken by real-life events and the need to respond to the needs associated with this current cluster. So more than 2 weeks on, we can see how the system has responded to an actual event, and it has responded well. As of yesterday, Our teams had identified 2,422 close contacts of cases, of which 2,368 had been isolated. That's a very high strike rate, and while the figures do vary from day to day, the teams are consistently performing around the benchmark of 80% of close contacts identified and contacted within 48 hours. There are now about 1,500 people using the National Contact Tracing Centre for the purpose of supporting contact tracing. And that excludes the management and supervisory roles who will also have access to it. Another major recommendation in the report was around the use of technology. And you will note that over recent weeks we've continued to improve the COVID-19 Contact Tracer app with additional functionality, and we have made the display of QR codes mandatory, the most recent change to that being making QR codes mandatory on public transport. Trials are also in train for new Bluetooth technology, including potential COVID card and other smart phone-based Bluetooth solutions. There are other important areas that have been identified for improvement in the report, but they're beyond the scope of the contact tracing teams alone, and they're being considered separately. But overall, I am very encouraged by the way our contact tracing processes are working in operating around this current cluster. The Ministry is innovating and it is responding quickly, and I expect this culture of continual improvement will, of course, go on as we continue to learn and adapt. And with that, happy to open up for questions. Yes.
We've now only got 3 days before Auckland is set to go down to level 2. With these high numbers, are you starting to feel nervous about whether that can happen or not?
No, because they're all still within the identified clusters, or cluster, but they're within the identified contacts. So we know what we're dealing with. We know roughly the size of what we're dealing with, and that's very helpful.
On current modelling, though, when will we start to get to those 0 and low case numbers that you would like to see?
It could be another sort of week to 10 days before we start to see the numbers dropping off again. Again, one of the things that we'll be monitoring very closely, as we do, is whether there are any additional cases that are coming up outside, a significant number of cases coming up outside of the identified cluster.
Shouldn't we have been doing that by now, though?
Oh, we're monitoring it every day. I mean, are you saying
Shouldn't those numbers have been dropping away by now, though? Because on modelling earlier in the week, we were expecting to get some low case numbers. I mean, seven's more than a handful of people.
I mean, one of the things that you'll see is that there are a couple of events that have potentially added significantly to our overall case numbers. And of course, we are also we're going through the day 12 sweep. So people who were tested early on are being tested again around day 12 because that fits in with our practice. And that is throwing up a few new cases, but there are already people that we knew that already been tested once. They're being tested again out of caution. And I think that's where you're seeing some of those numbers coming through now.
So just back on the earlier point there, do you think that we need to hit 0 before we move?
No, we don't. And that was actually one of the things that Cabinet considered. What we need to know is that we have the cluster reasonably well contained, and we are reasonably confident of that in the sense that the new cases we're seeing are within the cluster that's already been contact traced and identified.
How is it that second mini cluster appears to be growing though?
Given that it's got the contacts around it have been identified and isolated, and so we will reach the point where that shouldn't be spreading further. We're not going to reach that point immediately, but we should reach that point.
Are you concerned that cluster may be much bigger than we've picked up because you can't find that epidemiological link?
Well, we'd like to be able to demonstrate a link to the cluster, and a lot of the testing that we're doing around that cluster is for that purpose. It's actually looking further back in time to see if we can identify a source for this cluster. And as Minister says, the cases that we've got with that cluster are close contacts of each other. We will see as we get the further test results coming through from the testing that's been done through the church, whether there are any other cases. We can only hope that is the case, but we would feel happier if we were able to show what the link is from a person-to-person perspective with the large cluster.
The best analogy that I've used, and you will have heard me use it here before, is it's like trying to solve a jigsaw puzzle, and each new positive case is another piece of the jigsaw puzzle, and it helps to show how the cases are linked. And so there are still some gaps on the jigsaw board at the moment, and each new positive case that we get helps us to fill in another gap. I'll let you finish that question.
Sorry, it's a different question.
Okay.
But last week you said you'd issue a new order clarifying the requirements for airline crew coming back from overseas. Have you issued that order yet, and what are the requirements?
No, I haven't. We're still in conversations with the airlines about that. I'm meeting with Air New Zealand again this afternoon. Obviously, you will have seen the material that Air New Zealand released last week, identifying what their infection prevention and control measures are, the extra things that they are doing to keep the public safe. One of the things that we do not want to do is end up with no airlines flying in and out of New Zealand. It's vital that we have a really good, robust regime that allows the airlines to continue to operate, and that's what we're working through with them.
Isn't it more important to make sure that they're doing that safely? Why haven't you issued that new order?
We need to do both, and I'm absolutely confident that the regime that we are working up with them is very, very robust. There are good protections in place now, but we're just looking at how we can make them even better.
Just back on Sir Brian's report, a couple of things you didn't mention which require urgent action, very active cross-government approach and clarity of accountabilities and decision-making. These aren't small fry things. Why is it so far down the track and this stuff hasn't been sorted?
Look, no, that's not true to say that it hasn't been sorted. I think what you've seen in this particular exercise that we've been going through now, that a lot of that has improved hugely since the first time we had to do contact tracing. There are much more streamlined whole of government processes getting in behind and supporting contact tracing. The contact tracing centres are working very closely with other government departments who also have access to information, for example. The lines of decision making are much more clear. The Ministry of Health has been working to make sure that our public health units are operating on a coordinated nationwide basis rather than in isolated silos. So that work, a lot of progress has been made in that area.
So far improved, then why would Sir Brian be putting them in the camp of urgently need action?
Bear in mind that this report was several weeks ago, so continued work has been done. This has been an iterative process, and continued work has been done since that report was written.
In your mind, does a lot of this stuff come back to communication?
Yes, I mean, ultimately contact tracing is a communication exercise, and so, in a situation like this where you're trying to assemble quite a lot of information as fast as you possibly can, communication is critical.
If you go back to the report that Megan Woods and Digby Webb did, at that time, which is months ago now, Commodore Webb said that communication was the biggest failure out of that report and that was what needed fixing. But it seems as if these things that require urgent attention are still in the communication camp. So why aren't people speaking to each other and sorting this stuff out?
Well, no, I reject that. Like I said, that this report from Brian Roach was several weeks ago now, and actually a lot of work has happened since then. So you'll see that the system is continuously improving, and ultimately the results are the thing that we've got to focus on here, and the results here are actually very good.
Communication was also an issue like a couple of weeks ago over the testing of the border-facing workers when your cabinet strategy was quite different from the ministry strategy. So those issues are still quite recent, are they not?
Look, I think we've canvassed those issues around testing very extensively in these forums. But I think the communication is improving day on day. And ultimately, this is a people-driven system. Our contact tracing system is driven by people, and it relies on information being extracted from people, i.e. the contacts and the cases and their contacts. And so communication is we're always looking at how we can improve those communication channels, and I think that they've made very good progress in that regard.
Yes. Why, can you just further expand on why the exemption for taxis and Ubers and small passenger vehicles in terms of the requirement for mask wearing?
Because there's a variety of factors that we considered here. We considered the risk to those individual businesses in many cases, but we also considered what the public health risk was. And the overall advice that was presented was that the minor public health protection gain that would be made from getting people to wear masks in that setting were actually offset by the potential downsides for the operators concerned. And it would be very, very difficult for them to enforce. So if you look at the public health gain, people typically, when you're getting into a taxi or an Uber, you're not sitting next to people that you don't know, other than the driver who'll be wearing a mask. QR codes will be there, so we will be able to trace who's been in which taxis and which Ubers and when. And it's that smaller group size that, of course, provides the greatest protection. But people are encouraged to wear masks. They just won't be mandatory in taxis and Ubers.
Another question, just international seafarers, will they be required to be tested upon entry into New Zealand tested before or when they arrive in New Zealand?
So we're looking again at whether there can be further improvements made there, bearing in mind that if you're arriving and you're coming into New Zealand, you'll have to be tested and you're subject to our managed isolation and quarantine arrangements. The vast majority of people coming in on cargo ships, for example, don't actually enter New Zealand. They stay at the port. Most of them won't even get off the vessel at all. And so we're working through to make sure that the infection prevention and control piece of that is as stringent and strong as possible. A few further refinements to that system have been identified, and I've given the tick for them to be implemented. But you know, the issue around testing is still one that we're working through, bearing in mind that these people don't actually come into New Zealand.
Are you looking at any provisions? You know, there's some serious welfare issues, keeping these people in boats all the time, not letting them cross, through the port. Are you working on anything that would allow them more ease of access to New Zealand, to food supplies, all of that?
Most of the ships that come into New Zealand aren't actually here for very long, so they are, the workforces that we're talking about are well used to not stopping in New Zealand. They're used to being in and out. There is
Still leaving the ship, right?
There is provision for people to leave the ship and come through our managed isolation and quarantine. There is also provision for people to leave the ship and immediately return home, because obviously there's crew changes that need to happen with these ships, and we've got provisions in place that allow that to happen.
How
Can
many
you explain
close contacts there are in that Roskilde circle? Just 3 church services and 1 wedding, that's potentially hundreds. Do you know how many there are and how many of them have been tested?
Well, the investigation into the church service and the wedding is historic, and that's part of the investigation into the source for the current cases that we've seen at Mount Roskill. The actual containment itself is looking very good. There's 8 cases reported. They've all been close connections to each other. We will know as we get more of the test results back on the other immediate contacts who've been tested. But those particular events that I've mentioned is an example of how we're trying to see what the link might be with this cluster and events that we knew that happened in the past. And ideally, we would be able to identify someone who could then connect with the community cluster.
Sorry, my question was about how many of those close contacts have been identified related to those 3 church services and that wedding. How many have been identified and how many of them do you know have been tested?
I don't know how many of them have actually been tested, but they are being followed up by one of our other public health units, and that they're working through those numbers.
I'm sure we can get you the number. We don't have the number here, but I'm sure we can get you that number.
We collect those numbers.
Some questions about the enforcement with the public transport. So can you tell me how it will work with those fines and what part police will play? Will they wait at bus stops, or how's that going to work?
No, I mean, look, it's very similar to wearing a seatbelt. Like we don't have police stopping every car to make sure someone's wearing a seatbelt, and we won't be stopping everybody coming on and off a bus to make sure they're wearing a mask either. We are asking New Zealanders to comply with this. We are asking for goodwill. The advice, the evidence that we've seen so far suggests that people are actually ready to embrace these new rules, and there's a lot of compliance already, which is very heartening and very welcome. But we're not going to be putting police officers on every second street corner to make sure that people are wearing their masks.
Public transport, there are many people who don't use apps but use public transport. If they haven't registered their HOP card, which many don't, how do you plan to track those people?
That's one of the reasons that we're now putting the QR codes onto public transport, and we encourage people to register their HOP cards. There are other ways. If we end up needing to contact trace, someone on public transport, they haven't scanned their QR code and they haven't registered their HOP card, as long as we know what bus they were on and what time they were on that bus.
How would you know who to contact if you do find someone on that bus?
Well, because most of the other people on the bus will have registered their HOP card or be scanning the QR code.
For instance, I get on a bus, Jess gets on the bus, Jess tests positive and has a scan. I don't have a scan, I don't have a HOP card. How do you find me?
We do that through public notifications, which we have done. You would note in some instances through here we have been notifying public events where that assembling of the detailed list is more difficult. But we're certainly trying to make it as easy as possible for people to record their movements so that they can be notified when they have been in a situation where they're at greater risk.
If these cases aren't epidemiologically linked, by the end of this weekend, should Auckland still move down alert levels?
Look, I will ask Dr. McElnay to comment on that, but we did run through all of this when we made the decision around the right timing to move down the alert levels, and we did make that decision conscious of the fact that we may still be seeing positive cases at the end of, as we move down to alert level 2. The key piece of information that we are monitoring very, very closely is whether they are all still linked to the circle of contacts that we've been identifying, and at the moment they still are.
But you have no idea of the links in the chains of transmission, so you haven't seen links of. You don't know where those, how many other people those missing links have been infecting.
Look, that's part of the reason that we ask all close contacts to isolate, because as long as they are isolating, then if they subsequently show up as a positive contact, it doesn't create a lot of extra concern for us because we know that they've been isolating. But again, I'll ask Dr. McElnay to comment on that.
We have very small number that we can't epidemiologically link to the cluster, and we've talked about the Mount Roskill one, and we have got another situation of just one individual. We don't need necessarily to be able to demonstrate that link in order to be able to say that the particular cluster is contained, and we've got examples previously when we were in our first wave where we weren't able to make that link back to a source, but we were able to contain and have confidence that the cluster had been contained.
The 2 weeks in that case where you had restricted movement, so there was less movement going on. But in this case, if they move down alert levels, you won't really have those restrictions.
Well, it's also one of the reasons why we're promoting testing and widespread testing in the Auckland area, because that will allow us to detect any previously undetected cases, and that's part of the whole strategy, which will provide information to give us better understanding of what's actually happening.
Just on the report, it says ongoing attention required to ensure contact tracing system is reflective of Māori and Pacific needs. What do you believe those needs are, and what does a equitable tracking system look like that would get your tick of approval?
I mean, one of the things that we know from the current cluster is that we can do better at providing opportunities for people to record their movements and record who they're coming into contact with. So there hasn't been as high a use of the COVID Tracer app amongst the group that we've been dealing with to what we would have liked. And in fact, we've seen a significant uptake in usage of that since then. So that helps us. But in terms of culture, obviously we want to try and make sure that we're making this system an inclusive, respectful one, and that includes considering the demographics of the cluster that we're dealing with.
What does that look like? What does an inclusive tracing app look like?
Well, I mean, I think the app is, it's encouraging the uptake of the app is what we've been focused on here. But in terms of the specifics of contact tracing, of course we have Māori and Pacific people involved in the contact tracing process. We've been working very closely with community organisations that are active in the Māori and Pacific community. I don't know whether Dr. McElnay wants to add to that, but I think there has been a real desire to make sure that this is a very inclusive system.
I think we've certainly seen that with the approach in this current outbreak, the communication and the links, particularly with communities in Auckland, Māori and Pacific communities, that helps understanding around what the questions are that are being asked, and the answering any queries that people have about the disease, and also about the need for self-isolation while we're undergoing those initial tests. And that's been invaluable in this particular cluster, to have those teams at Auckland Regional Public Health able to have those conversations direct with individuals and also their community leaders.
Okay, we'll come back over this side of the room.
Minister, to clarify, in terms of looking at the current restrictions again before Sunday, will Cabinet meet tomorrow to review that, or on Saturday over the weekend?
No, there's no plans currently to review whether or not the decision that we've already made should go ahead. We would do that if we got some evidence that suggested that we needed to somehow change course. At this point, we haven't seen any evidence that suggests we need to change course.
Just a question from a colleague. Is there any consideration for a second quarantine hotel in Auckland because people from the community and the border are now staying at the jet park?
At the moment, we can accommodate, what we need to accommodate within the jet park. Of course, if we need to stand up additional quarantine, then we have the ability to do that.
Minister, with your education hat on, how did the Green School get $1.7 million worth of funding?
It was a shovel-ready project, so it wasn't considered through the usual education capital spend route. It was considered as a shovel-ready project, so the criteria for that were different. The criteria for that looked at the, is it a building project? Yes. Is it ready to go? Yes. Can it be done quickly? Yes. And it was funded through that.
But a lot of other
Is
schools
putting
have-
millions of dollars into a private green school really a good use of public funds?
Look, ultimately, that was something that the Green Party advocated quite strongly for, and so it was one of their wins, if you like, out of the shovel-ready project area, and so that's a question for them.
Are you happy with that, the funding?
Look, it's not necessarily a project that I would have prioritised.
There an
So
element
on
of
the
hypocrisy from your
70,000
government
number
on this,
for
given
funding, for testing that you
Yes.
have been aiming for. Are you 100% confident that you're going to hit that target? Just because in the last couple of days we haven't managed to get to the 7,000 number in Auckland, and then with the weekend coming, we also know that testing goes down over the weekend.
Yeah, so we've been sitting just below the 10,000 overall number of tests across the country. We are in the process, as you know, of standing up additional testing centres and doing more work in that area, and that takes a day or two to flow through into the number of test results that we see, we'll keep pushing it. The 10,000 is our goal, so we're going to continue to 10,000 average. We're going to continue to push that.
Just back to the green school thing. Can you see how for some principals at low decile schools, that amount of funding going to a school like that seems galling?
Yes, I can, and I'll just remind you, it's not education funding that's going to that. Yes.
Do you accept that there's an element of hypocrisy from your government on that? Do you accept that there's an element of hypocrisy from your government here because you rallied so hard against charter schools and now you're pumping millions into private schooling?
Look, I said that's not, as I said at the beginning, that it's not education funding that's going into that. It's a shovel-ready project, and really that's a question for the ministers who are involved in the shovel-ready project process. Jo.
Just to come back to Sir Brian's report, given that you say we can't take it at face value because it was a couple of weeks ago and things have moved on, can you give me one or two examples in that sort of all-of-government approach, communication approach, where you've fundamentally changed something in the last couple of weeks that has made that system better, and what is it?
Yeah, we do have one person now based in Auckland who is leading the overall public health response around contact tracing. So that is, an advance. It's basically about, straightening up and clearing those lines of accountability, and that has been happening. So. And the way the all-of-government group are operating around supporting contact tracing has also tightened up as well. We now have a much more streamlined process for how we consider the new case numbers every day to make sure that all of the arms of government that need to be connected into that process are connected into that process. So I'm confident that it is operating in a much more streamlined way than it did previously.
You're happy to